My name is Rosalia Baldo. I am from Chicago, Illinois. I am here because I've wanted to get my nose done for a while, and I've done all the research on all the doctors for the last 3 to 5 years. I haven't found someone that made me feel as comfortable as Dr. Dugar, and I was looking for something very specific because I didn't want much of a change, but I wanted a more refined, feminine version of myself. I want to be a little bit more confident on the camera, in my profile. Honestly, I just want what I already have, but just a subtle version of it, a subtle change.
So today we're working on Rosalia's nose. She's a gorgeous patient from Chicago. She has a beautiful face and a great nose. We don't need to do too much. And that's the favorite type of patient that I usually deal with, is patients who don't need too much with my closed Scarless Rhinoplasty technique. With her nose specifically, she's concerned about the width of her nasal bones and also the strength of her side profile. She also feels like when she smiles, her nose hooks down a little bit. So those are 3 of the most common complaints we get with patients, including also bulbous round tips and also asymmetry or crookedness sometimes. In her case, she also has a deviation of her nasal septum, so we're going to be fixing her breathing during her surgery as well. With her nasal bones, they are a little wide, and so we want to narrow those so she gets a little bit more elegance to her nose from her frontal view, and then from her side profile, she feels like her nose is a little too strong. So we want to shave down the side profile just to give her a little bit of softness, and then elevate the tip just a touch. The key will be really subtle maneuvers to give her that elegance that she's always wanted. Well, we're about to go into surgery now to take care of Rosalia's nose with her Scarless Nose procedure. Let's get to it. Step 1, injecting local anesthesia. Step 2, making the incisions to address the deviated septum. So we're making our incision along the caudal edge of the septum to access her septum to correct the deviated portion. Step 3, removing crooked pieces of cartilage from the deviated septum to give her better breathing the rest of her life. So we're pulling out the deviation. This part was crooked along the side of her nose, and so by correcting it and pulling this crooked part out, we're able to give her better breathing from the inside of her nose. Step 4, making the incisions into the nose to address her strong cartilaginous and bony profile. Step 6, shaving down the cartilaginous profile by removing small slivers of cartilage. So we're showing how we're removing just a sliver of cartilage. This 1 micromillimeter of cartilage that we remove from the profile will allow us to soften her profile, and next we'll go after the bone. Step 7, shaving down the bony profile to reduce the strength of the bone. So we've shaved down her cartilaginous profile, so this has become a lot softer. Now we're going to go after her bony profile. This part here, higher up, is the bone. And the way we do that is we use an instrument called a Rubin gouge. This instrument will allow me to pick up the part of the bone that's elevated and remove it to give her a softer profile from top to bottom. So what we did now is we've removed this tiny piece of bone that was here, and by removing this piece of bone, it allows us to give her a softer version of the same profile. So we're able to give her that softness from top to bottom. And now we're going to finesse this a little bit more with a rasp. This is an instrument to smoothen the edges of the bone. Step 8. Carving cartilage grafts from previously removed septal cartilage to place as spreader grafts to give strength to the middle third of her nose. So this is the cartilage that we previously harvested from her deviation in her septum. We're now going to carve this, and we're going to use this cartilage to rebuild and restructure the middle of her nose so that she doesn't have any pinching, and that long term she doesn't get any obstruction in her breathing. These are called spreader grafts, and by placing these in the mid third of her nose, we not only strengthen the nose, we also get better optimized breathing for her the rest of her life. So these are the pieces of cartilage that we removed from her septum that were crooked, and now we're going to place these back inside the middle third of her nose to give structure and support so that her nose always has good support along the mid third. These are called spreader grafts. Step 9, narrowing the bones. So we're showing her nasal bones that are very wide. You know, in photos it doesn't necessarily show how wide they are, but you can really see now how wide her nasal bones are. And this is what makes her nose not look as refined. So what we're going to do next is we're going to narrow these nasal bones to bring them in so they're not nearly as wide. right, so now we've narrowed the nasal bones. We brought them into good alignment to make her entire nasal silhouette much thinner. So you can see the difference once we've thinned and narrowed the nasal silhouette. So now the entire nasal bones have been brought in, and her nose is going to be much thinner from top to bottom now. Step 10, closing the incisions. So what we're doing now is we're closing the incisions on the inside of the nose, so there's no external cuts or scars. So everything is all done on the inside of the nose, and this allows us to close without having any signs or telltale signs of surgery, because there's no external cuts or scars on the patient's nose. So we're all finished. Surgery came out amazing. I cannot wait for her to see this and to see the reveal. We gently sculpted down the profile to make it the softer version, and then we narrowed the bones to become the softer silhouette that she was looking for. With slight elevation of her tip, came out stunning. Now we're gonna cast and tape the nose. Final step, taping and casting of the nose to give tight compression to reduce swelling of the nose post-operatively. Swelling is the #1 thing that makes the nose not look amazing, so we want to decrease that chance by keeping it compressed. And when the cast comes off, she'll be able to enjoy how nice her nose looks even 7 days after surgery. So we just finished surgery. It went phenomenal. I'm so excited for Rosalia to see her nose. Came out stunning, and the reason is we stayed true to our Scarless Nose closed rhinoplasty philosophy. Subtle, minimal change with no drastic change. From her side profile, we shaved down the cartilage and bone to give it a little bit of softness that she was looking for, as well as elevating the tip just a touch to give her less of that droopy look when she smiles. From the frontal view, her nose was already great. We just wanted to narrow the bones so it didn't look as wide, especially when she's smiling. So narrowing the bones to give her that soft, feminine look that she wanted. I'm ecstatic with how the surgery came out, and I'm so excited for Rosalia to see her nose, and I can't wait to see how she reacts the first time she sees her brand new nose.
My name is Rosalia. I am from Chicago. I am 7 days post-op, and the experience, besides the 2 days of mild discomfort, was a breeze. I've had multiple other surgeries from athletics, and this is nothing compared to that. I was out to go to sushi, I had some frozen yogurt, so I made, good time of it, so. My pain level was, for the first 2 to 3 days, was just more of an uncomfortable. There wasn't like a shooting pain or a sharp pain. It was just, a little pressure, and after the 3 days passed, it started getting better. The more I iced, kept my head elevated, it was a breeze, so it was nothing. It was good. I have seen a few different doctors, been to many consultations, and I wanted such a slight minimal change that after going to them, all the doctors wanted, to completely change how my face looked. They wanted to give me a scar that I really wasn't wanting for such a small change. And after, meeting with Dr. Dugar, I enjoyed, his talks and educating me, and I found out that closed rhino was for me. All right, it's time. I'm so excited to see it. My whole family keeps texting me, asking me for pictures. So I'm nervous, but I'm really excited. Let's do it.
You ready?
I am.
All right, we're gonna get this off today.
I'm really excited.
All right, great. So the biggest thing is that your nose, when we first take the cast off, you're gonna get that instant look to see what it looks like.
Okay.
And then after time, you'll get a little bit of swelling. So, but right now, as soon as it comes off, you're gonna get an instant peek.
Okay.
All right, so I'm gonna take this off. We're gonna show you exactly what it looks like.
Okay.
All right, let's do it.
I'm excited.
All right, you ready?
I'm so ready. Oh my goodness. That's so great. Wow. It is so subtle but perfect. Thank you.
Yeah, you're welcome. It looks really good.
Yes, it does. Oh, that's incredible. I really, really am happy with my results. They're exactly what I was looking for, that, happy in between, not too much, not enough, that why am I doing it, but just that subtle, a little bit more feminine version of myself that I was looking for. I'm really excited to, see how my results continue to heal and get better. But right now, they're fantastic, and I just couldn't be more happy, so. Thank you, Dr. Dugar and his team.
We're really happy for you, Rosalia, and we're really happy for your results, and we're excited for you to see the continued changes over the next 1 to 3 years as it fully molds and heals. closed scarless rhinoplasty is made for noses like yours, where we just want subtle changes without any drastic refinement, so nobody knows, and yet it's your subtle scarless secret.